Hi, I'm Antonio Gayoso. I'm the founder and a practicing surgeon at Gayoso Plastic Surgery. Male breast reduction is a very common surgery performed on men who feel like there's too much fullness in their breasts. Abnormally large male breasts are common from adolescence through the senior years. Fortunately, reduction of the male breast is an extremely effective and minimally scarring procedure, which produces very good results. The great majority of the time when we're reducing the male breast, we're taking out fat and some breast tissue from behind the nipple and the areola without making much of an incision at all. The incisions are smaller than your little fingernail, and they result in less prominence and less fullness. I do a lot of the procedure with liposuction, but I also remove the breast tissue. You can't liposuction breast tissue out because it's a more firm tissue. So we combine liposuction with removal of breast tissue through tiny incisions. This operation is good for men who have too much fullness in the breast, whether it's from age and fat or whether it's from abnormal breast development. The procedure makes it so that you can wear a tight t-shirt without feeling like your breasts are too prominent, or you can take your shirt off at the beach without worrying. So in male breast reduction, I think that the benefits are a lot like losing a bunch of weight and feeling great in your clothing. It's just that male breast reduction cannot always be achieved just by losing weight, and that's where the surgery really fits in nicely, is to help with things that aren't going to get better just by lifestyle changes. Preparing for a male breast reduction surgery is not that complex. It is helpful for patients to be near their ideal weight, but it's really not necessary. We can deal with a patient at whatever weight they are and reduce the breast in a way that is proportionate with the rest of their body. The recovery from gynecomastia surgery or male breast reduction involves wearing a compressive vest, but we like to compress the area. So we'll have you wear a vest, sometimes a sleeveless vest with a little foam padding. We like to compress that area to make sure the healing and the shape are as good as possible. That involves wearing that compressive vest for a few weeks after surgery. And it is a slightly cumbersome thing, but it does fit under clothing. We can certainly transition from something that's a little more snug at first to something that's more comfortable after a week or two. My patients who have male breast reduction surgery are generally advised not to do a lot of running or jumping or upper body exercise for about a month or a little bit more afterward. That corresponds to the time when a patient would be wearing a compressive vest to make sure that things heal well and not to traumatize the area that's healing.